One of the great things about Muscle IQ Physical Therapy is we have the David Spine Concept machines, and these machines allow us to test your strength. So somebody might come in after a car accident, and we will test you on the first day to see how strong your neck muscles are, your back muscles, your knee muscles, or your shoulder muscles, and we'll print off a report telling you how strong you are compared to what normal should be for somebody your same age, height, weight, and gender. This test was the final evaluation for a patient that came in after a car accident. This person had injured their neck and their back, and they started off very weak, but we got them back to normal strength. So let's review this test result. So this person came in August 1st of 2018, and we had their final test on November 29th, 2018. And during the first test, the patient showed significant problems with their range of motion and significant weakness with their testing. So just showing you here, this gray area here represents what normal should be for somebody, this person's same age, height, weight, and gender. Anything to the right is above average. Anything to the left is below average. So they started off below average with range of motion for a lot of the cervical spine or neck range of motion. So this section here is mobility or range of motion, and this section here is strength. So when you first come in for your first initial evaluation, we'll measure range of motion and we'll measure strength. So this person, strength-wise in the cervical spine, bending backwards into extension, pushed at a strength 64% below normal. Side bending to the right was 63% below normal. To the left, 73%. Rotation right and left, 76, 65. And then with the lumbar spine, bending backwards into extension was 62% below normal. Forward was 62% below normal. Rotation right and left, 64 and 69% below normal. And side bending left and right, 74 and 76% below normal. We retested them again on October 9th, and that's the blue line. So the blue line here, range of motion was still limited for the neck, bending forward and backward, but the other measurements had improved significantly. Forward bending with the back, lumbar spine was also a little bit limited. The neck strength on the second reevaluation showed that they had made significant gains, almost back to normal, and side bending to the right was past normal. Side bending to the left was still limited, and rotation right and left in the neck were still below normal. The low back strength was 29% below normal bending backwards, 16% below normal bending forward, but rotation right and left had gotten back to in the normal range, and side bending to the right was greatly improved, but still below normal, and still below normal side bending to the left. On the third evaluation on November 29th, the patient had made improvements on their range of motion. Everything was within normal limits or higher for range of motion for the neck and back. And for strength, neck range of motion or neck strength was within normal limits for every single test. And for the lumbar spine was within normal range or better than normal for all their tests. So this patient had a successful outcome, and the reason why we want to see patients get to normal strength is normal muscle strength protects, weak muscles lead to further injury and pain. So if a patient were discharged before they got back to normal strength, we have no way of knowing whether or not they're going to get back to normal strength. There are no studies that do this type of testing to show whether anybody actually makes very much in strength gains after their final visit to physical therapy. So we always try to help our patients get back to normal strength so that we've got proof that they are ready to take on normal activities and not see degradation that leads to further pain and injury in the future.